Welcome to In a Heartbeat, coming to you from the studio of WMTV Channel 5 in Grosse Pointe Farms at the Grosse Pointe War Memorial. We are broadcast also throughout southeastern Michigan on AT&T UVerse on Channel 99. I'm Dr. David Bali, and I'm your host for In a Heartbeat. Our Tigers this past season really gave us a thrill and something to cheer about. They even made it to the playoffs despite being plagued by several injuries. Sports injuries and everyday wear and tear on our bones and joints can send us to the doctor for needed repairs and sometimes replacements. Well, today, my special guest is coming to see you and will be making a house call on In a Heartbeat. He is a return guest, which I'm honored to have him back, and he's also a board-certified orthopedic surgeon and the team physician for both the Detroit Tigers and the Detroit Pistons. He's also director and now president of the DMC Sports Medicine Athletic Fellowship Program, and an all-around great guy. And I'd like to introduce you or reintroduce you to Dr. Stephen Lemos. Dr. Lemos, welcome back to In a Heartbeat.
Good to see you. How are you?
I'm great. I'm great. Thank you for coming back. I'd like to start out, Dr. Lemos, for those viewers who may not be familiar with you, if you could share with us a little bit about your practice and some of the many hats that you wear related to your specialty.
Sure. My practice is focused on sports medicine, but I have a very, that to me covers a large scope of injuries and other things that can go wrong with our bones and joints. For instance, I treat arthritis as well as rotator cuff tears, that would be of the shoulder, and other things like that. For instance, I also do knee replacements, shoulder replacements, elbow replacements, but also I treat, so I treat people that are basically from every age group, because I also do pediatric orthopedic surgery that is related to sports. I also do the high school and college age, as well as older folks who just want to stay active, and that may mean doing an ACL reconstruction in the knee, but it also may mean doing a knee replacement. So my goal is to get people back to doing what they want to do.
Great, that's what we all want. Dr. Lemos, you had shared with me that you, and as part of the DMC, have opened a new center for education and research. Tell me about that.
Sure. The DMC Sports Medicine program has several tenets and aims to try to make a sports medicine center of excellence. And one of the aims is clinical excellence, but we also, and another one is community outreach. But to also help us with that and to basically be on the cutting edge of medicine and of treatment of problems with patients, we really like to do something to be able to do that. And what we did is we set up a Sports Medicine Center of Excellence, and that focuses on education and research. It is a really nice facility, and it has 2 practice operating rooms in it. It has a research lab, and in the research lab is something called an Instron, which is a type of instrument that can measure how things heal, how strong repairs are, things like that. Because what we do as orthopedic surgeons oftentimes is repair things, repair tendons back to bone, even if you do a knee replacement, you want to see how that works. You want to see how strong it is, how long it might last. So we have instruments and equipment that can test that. And the nice thing is that we can do practice surgeries and then test that in the lab. I do my surgeries in two ways. One is the traditional way, where you make an incision and you know, fix a joint or put a knee replacement in or something like that.
Mm-hmm.
I also use an arthroscope, and what that is, it's a camera. It uses fiber optics, and you can look into a joint with it and do everything from a rotator cuff repair to an ACL reconstruction. Those are more common things that people may know about. But it is not an easy thing to do, and it takes years of practice to become proficient at it. So what we do is take residents, and actually I have a fellowship as well. And what a fellowship is when a resident completes their residency, which is 5 years of training after medical school, if they want to specialize in sports medicine, they do an extra year. And it's
a lot of years.
It is a lot of years, but we have 4 fellows a year, and that for the fellowship, as well as...
And that's a program that you've helped to grow and develop, isn't it?
Actually, yes. We started that approximately 5 years ago, and it's started from the ground up, and it's really been very successful. But these fellows and residents both can go to this, the Center for Education and Research, and practice their arthroscopic skills. And it's been great. It really helps the learning curve, so that when a new orthopedic surgeon leaves our program, we are very confident that they'll have the skills necessary to perform those procedures.
Dr. Lemos, can you share with us and our viewers any of the research that you or your program may be involved in at this time?
Sure, and a lot of it is groundbreaking. The one thing that we just recently published was something for when someone has arthritis on the end of their collarbone. So right here, a lot of people have this, they have pain here. Mm-hmm. Well, we treat that non-operatively at first. We have them do physical therapy and things like that, and maybe a cortisone injection. If that fails, then we do surgery on it. And one way to do surgery is to clean out the arthritis in that joint. And until recently, what we did is we took it out of just from one end of the collarbone. We would take the arthritis out. The problem with that is that it might make that joint unstable. So we just did a research project looking at taking the arthritis off from both sides of the joint to see if that would help with stability. And no one has done any work like that before, and we did it and showed that it actually increased the stability, so it would decrease the complication rates after that procedure. The 2 other things that we've really focused on is right now there's something called PRP, or platelet-rich plasma. Mm-hmm. And that is a product that you take blood from yourself, spin it down in a centrifuge, and you're left with different layers. And one of the layers has platelets in it. And stuck to the platelets are some factors that basically can supercharge the healing response. It's out there in general publications and things like that, and people may have read about it, and it's called PRP. And what we've been doing is studying how best to use that. There's not a lot of research. Yeah, it's very exciting, and there may be many applications for it, but we're trying to define what those applications might be.
Could this PRP have perhaps some functionality as, say, for example, like a stem cell type of thing, where it may allow repair of tissue that's difficult to repair or replace?
There is a possibility that it could be used in conjunction with stem cells. So the difference is that with this, you're using these platelets that have the factors stuck to them that may be able to supercharge your own cells into a faster healing response or a better healing response. With stem cells, that you might be able to use those in conjunction with that, and I don't think anyone has tried that yet, to maybe to speed up the proliferation or the growing of the stem cells if you're using it for something in particular.
That's great. And Dr. Lemos, you do a lot of rotator cuff repairs.
Yes.
For our viewers, could you perhaps explain what that is?
Sure.
And then you do something special, I believe, called a bar cart repair.
Yeah. Let's start with the rotator cuff repair first, okay? And so traditionally, rotator cuff repair, and that's the rotator cuff. Let me explain that first. It's made of 4 muscles, okay? And it surrounds the shoulder, okay? The shoulder is a ball and socket joint. The hip's a ball and socket joint as well. But the difference between the shoulder and the hip, first of all, you can move your arm many more places that you can't with your hip. And the reason is the cup on the shoulder is more like a saucer than it is a cup. And the ball is much bigger than that saucer. Mm-hmm. So when it sits on there, if there was nothing else holding it, it would not stay in joint. So the rotator cuff surrounds that with the 4 muscles. There's one in the front, it's called the subscapularis, one on top called the supraspinatus, and then there's two in the back. One is the infraspinatus and the other one is the teres minor. So 4 muscles, and they're very important to keep the shoulder in place. And what happens is if you tear, and the usual rotator cuff muscle that's torn is the one on top, the supraspinatus. And if that tears, the shoulder then can ride up. So you take that one out, the shoulder can ride up, and there's a bone right here called the acromion, and it hits the acromion and causes pain.
That can be very painful.
Very painful, and it's interesting. What usually gets people in to see me is not the pain that they have during the day or when they reach out to grab something. It's sleeping. They have a really hard time sleeping when they have a rotator cuff problem, and that brings them in to see me.
Can I ask you, why would it be? Is there something about the positioning of the shoulder while sleeping that does that?
I think it is, and a lot of people say if they roll on it, it hurts, and so they're not. And when you sit up, the other thing is gravity takes the arm and brings it down and away. So
that makes sense.
And part of our research right now is looking at something that people can use at home to help pull their shoulder away when they lie down.
Wow.
Because one thing we found is if they sleep in a recliner or in more of a sitting up position, they actually have less pain. So one thing we thought of is, but people have a difficult time sleeping like that. So if we would put something on their arm to pull their shoulder down, it may help to decrease their pain. And we're actually doing research on that right now.